What are the core principles of bioethics? Have you ever wondered how ethical decisions are made in healthcare and scientific research? The field of bioethics plays a vital role in guiding these choices. It focuses on the moral issues that arise in medicine, biology, and life sciences, especially regarding human life and well-being. The core principles of bioethics serve as essential guidelines to ensure that medical practices respect human dignity and promote fairness. The first principle is respect for autonomy. This principle emphasizes that individuals have the right to make informed and voluntary decisions about their own health care. Patients should receive all relevant information without any pressure, allowing them to exercise self-determination. Respecting autonomy means honoring patients' choices, even if they differ from medical advice, as long as those choices do not harm others. Next is beneficence. This principle involves acting in ways that promote the welfare and best interests of patients. Healthcare providers have a responsibility to contribute positively to the health and well-being of those in their care. Beneficence encourages proactive efforts to help patients, improve their conditions, and support their overall good. Closely related to beneficence is the principle of nonmaleficence, which means do no harm. This principle requires that medical interventions avoid causing unnecessary physical or psychological harm. Any potential harm must be justified by a corresponding benefit. Non-maleficence serves as a safeguard against reckless or harmful practices in health care. The fourth principle is justice, which concerns fairness in the distribution of healthcare resources and treatments. Justice demands that patients have equal access to medical care without discrimination, based on race, gender, socioeconomic status, or other irrelevant factors. It also involves the ethical allocation of limited resources and ensuring that benefits and burdens are shared equitably within society. These principles do not work in isolation. They interact dynamically. Ethical decision-making in bioethics often requires balancing these principles based on the specific context and needs of each case. For instance, respecting a patient's autonomy might sometimes conflict with beneficence if a patient refuses treatment that could benefit them. In such situations, careful ethical reasoning is needed to navigate these tensions. From the perspective of ethics and morals, these principles reflected fundamental values such as respect for persons, kindness, fairness, and responsibility. They guide healthcare professionals and researchers to act not only legally but also morally, ensuring that scientific progress and medical care uphold human dignity and minimize harm. In practical terms, these principles influence policies, clinical guidelines, and laws related to medical practice, research involving human subjects, end-of-life care, and genetic interventions. They help society address complex questions raised by advances in science while maintaining a commitment to moral integrity and respect for life.